Icons, 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 yes, we the icons. Icons, 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 yes, we the icons.
Self, I'm an icon. Fresh, put my tie on. Check, put the mic on. Restless, we fight on. Tempted to buy one. Next up, the icon. Next up, the icon. Yes, we the icon. Yes.
Icons, 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 yes, we the icons. Icons.
Huge round of applause, ladies and gentlemen, for the man behind making healthcare affordable in the UAE. Dr. Sanjay Paithankar, founder and executive board member of Right Health Group.
Pushing progress till end of time. 'Cause we so iconic. Yes, we so iconic. Yes.
जिंदगी में हादसे होते कुछ अच्छे के लिए कुछ बुरे के लिए एंड इट सो हैपेंड कि एक यहाँ का शेख ही केम एज अ पेशेंट टू मी इन ब्रीच कैंडी एंड आई डिड एंजियोप्लास्टी ऑन हिम इन 1986 then he requested me, why don't you come to Dubai, because they wanted to start this angioplasty program which was quite new in the world that time. और उसके बाद उन्होंने मेरे को बोला कि आप आ जाओ, we'll give you the job. See, basically coming to Dubai was to earn 5 lakh rupees so that I go back to Nagpur, start my own hospital in cardiology and try to save as many lives as possible. वो 5 लाख कमाने के लिए, जल्दी से कमाने के लिए मैंने ये चुना कि दुबई सोने की नगरी है, हो सकता है मेरा जो 5 लाख का सपना है जल्दी पूरा हो जाए. इंडिया में रहता तो 5 लाख कमाने के लिए मेरे को कम से कम 5 साल लग जाते थे, पर यहाँ पे थोड़ा सा शॉर्टकट था क्योंकि कुछ तमन्ना थी, कुछ इरादे थे, कुछ हौसले थे. इसलिए मैंने बोला चलो लेट्स ट्राई दुबई. Earn money, 5 lakhs, go back to India. I belong to an absolutely typical Indian middle class family. There was a turning point in grade 12. My father's sister, she had visited us during the summer vacation. She was 32 years old. She had traveled from Baroda by train. It was summer. And you'll be shocked. Within minutes, she said she is not feeling okay. And we lost her. That was a shocking thing for me, that how at such a early age, how people can die. And that was the reason why I decided, no, I will have to go to medical, find out the reason what is this happening, and try to save lives as maximum as possible. And that's why it was not only medical. I had determined in the grade 12 that I will do my medicine, post-graduation in medicine and super specialty in cardiology, which I achieved. In those days, Dubai was very, very different than what it is today. Today, it is one of the most developed country in the world. Healthcare was very different. It was restricted to the government hospitals. There were private clinics, but not much hospitals who were offering ultra-modern treatment. Also, healthcare insurance was not mandatory in those days. So whatever healthcare you needed, you had to pay money for it and get the healthcare done. And the cost of healthcare as compared to India was at least 5 times. So it was a very costly affair for the laborers to get a good healthcare during that time. जब मैं इंडिया से यहाँ पे आया था and I started working in cardiology department, I was one of the Indian cardiologists working in the government hospital. तो उसके कारण इतने पेशेंट आते थे हमको रेफर होके. Because I was working in cardiology, there were a lot of doctors in the private who were referring cases to me. पर जब मैंने खुद की प्रैक्टिस चालू की, वही लोग जो मेरे को रोज पेशेंट भेजते थे, वो लोगों ने पेशेंट भेजना बंद किया, क्योंकि मैं हर केस में प्रोफेशनल ज्यादा ओपिनियन देता था एंड नॉन कमर्शियल. I was against paying any undercut to anybody. My argument was very simple. If at all any benefit in cost, it will go to the patient. And I wanted to be a very clean practitioner. Well, it didn't affect me, to be very frank, because I didn't want to leave my ethics in practice. During the same time, I was running clinics for poor people in the labor camps. So there was no dearth of patients visiting my clinics in the labor camps. And I started working in the labor camps, not as a cardiologist, but giving general medicine practice, a GP practice. And it was a successful. Because those patients needed healthcare which was not available to them at an affordable cost. Well, it was very simple. We doctors do take a Hippocratic oath in which we say that we'll be serving the society, we'll serving the poor, and not only serving the poor, we'll be healing them. And he's not poor by choice. बस भगवान की करनी है, उसको गरीब बनाया, लेबर बनाया, उसकी कुछ गलती नहीं है. And as I said, health is a fundamental right of an individual. I had decided कि irrespective of money, I'll be serving the people who need a healthcare in this country.
Dubai, there are three basically most expensive things that happen, right? So one is education, one is housing, and the third one is healthcare. All three are super expensive. And why not be a part of an organization that's reaching out to the maximum number of people? When you know that Right Health takes care of more than 2 million lives in a year. So that itself is motivating, that you're not just doing it for a few people who are actually who can really afford good healthcare, but here are the people who really don't afford it, and we can serve those people. So I think that's the motivation behind it.
I was on emergency cardiology in Dubai hospital at around 3 a.m. in the morning. When I was just going back after treating a patient, I saw a young Pakistani on a wheelchair. I didn't feel the way he looked he was very comfortable with the problem which he came. I requested one of the nurses to do his ECG. Nurse shouted at me, "Dr. Sanjay, you people only think in one direction of cardiology. This patient is having some muscular pain. He has been given pain relief injection and he's going." I said, "No, sister, can you please help me? Just do an ECG. I'm not very happy to looking at his face. It looked pale, in pain and all." So we did a ECG, and shockingly, this young man had a heart attack. I rushed him to the cath lab. We did an angioplasty, saved him. Next day, when I asked him why did he not come to the hospital for last 3 days and how he was bearing the pain, and the answer was very shocking. He said since last 3 days, he was trying to relieve the pain, chest pain, by drinking ice cold water. And then I asked him, "Why you didn't come?" He said he stays in the area called Sonapur, which is a bit far off from the city limits of Dubai. And there was no proper transport available for him to come. And also he did not have money. I was a bit shocked, because in a place like Dubai in those days, and healthcare not available to the people was surprising. Next day itself, I visited that place, and I was surprised that this area, which are labor camps area, and there was no basic healthcare available to anybody in that area. The nearest health facility available to them was around 4 to 5 kilometers, but the transportation was difficult. Then I thought, no, it is my duty that if they cannot reach us, we have to reach them and offer a absolutely basic healthcare, which is not there into that part. Most of these labor camps were on the outskirts. Then it was in 2018, by the time we had 34 units, my both daughters are not into medical line. To go forward, to expand, I thought of joining hands with people who are like-minded and who could support me in my venture. So we joined hands, acquired clinics, and we labeled the group as Right Health.
Dr. Sanjay is committed in providing a quality healthcare. So he has assigned me the responsibility as a head of medical compliance and medical director to ensure that he provide quality of service, but at a very affordable rates. So affordable, when I'm saying affordable, it is in such a rate that you would be surprised that you can get a consultation for as low as 20 dirhams to 30 dirhams. That only happens in Right Health. He cares so much about people that he has started an initiative called Save a Life Initiative, which I'm personally leading. And so far we have went to a lot of camps. We have reached out more than 1,000 of people on teaching how to save a life, what to do in emergencies, even if you cannot afford a healthcare, where you can access it and where you can gain it.
2018, we started off with 2,000 patients per day. And our footprints were in practically all the labor camp areas where the things were. Basically, we were the first people to reach the areas where nothing was available. Our aim was just to give them a quality healthcare at affordable cost on their doorsteps. जो खर्चा वो लोग ट्रांसपोर्टेशन में यूज कर रहे थे, उससे आधे खर्चे में मैं उनको ट्रीट कर रहा था. एंड द पीपल वर सो ग्रेटफुल. यू विल बी सरप्राइज्ड दैट इन दैट एरिया चोरियां होती थी थोड़ी बहुत, बट हमारे क्लिनिक में कभी चोरी नहीं हुई, क्योंकि वहाँ के जो सो कॉल्ड लॉर्ड्स थे, दे यूज्ड टू टेल कि ये हमारा क्लिनिक है करके. When nobody has entered into that place, we ventured into that place and gave them, and they were very grateful.
डॉक्टर संजय बहुत अच्छा आदमी है, बहुत अच्छा बात करते हैं, बहुत अच्छा ट्रीटमेंट करते हैं. बाकी क्लिनिक से राइट हेल्थ क्लिनिक अच्छा है, डिस्काउंट भी देता है, कभी फ्री में भी इलाज करता है, पैसा नहीं है तो आदमी का फ्री में भी इलाज करता है.
डॉक्टर के पास जाएंगे ना तो सबसे पहले मेन चीज़ होता है डॉक्टर की ट्रीट. आपको वो ट्रीट कैसे करता है, इंजेक्शन से नहीं, उसकी बात से. जब भी वो बात आपके साथ, उसका बिहेवियर या उसका जो बात करने का अंदाज है, वही आपको आधा ठीक कर देता है. ये चीज़ मैंने सबसे अच्छी राइट हेल्थ में देखी.
See, basically, Right Health, as I told you, that it was formed in 2008, end of 2018-19. We had 63 units all over UAE. Unfortunately, the clinics which were acquired, along with my clinics, they were not doing very well. During COVID, that myself and my team have played a very crucial role in this part of the world. We were out onto the fields treating patients right from the day one. And by the way, I did the first PCR test of this country. It was on 7th of March, 2020. Actually, when we took over and started Right Health, it was 2,000 patients per day. But in COVID, it went to 8,000. And by 2022, we were seeing around 2,500 patients. Of course, we had around 550 staff. As of today, we have 750 staff. As of today, we see 3,500 to 4,000 patients per day. We have now grown to specialists. Initially, I was only interested in serving and giving the basic healthcare, but we, in 2022, post-COVID, we discovered that our patients, when we have crossed 3,000, every day we generate almost 300 patients who need a specialist opinion. So we thought of appointing specialists who will give the services not only to our patient but also to middle class people. So we added a typical hub and spoke model where we had peripheral clinics and specialists sitting in the center. But that didn't solve much of our problem, because even the transportation cost for my patients to come from the peripheral clinic to the hub was difficult. So we took special permission from the government to allow our specialists to work in the peripheral clinics.
We strongly believe we as a Right Health deserve to have an hospital, a primary, secondary care and tertiary care hospital, which we are currently working. In fact, I'm working on the plan and then which will be submitted to the board. And once we get the approval, you will see us further one step ahead of the ladder. So that is our goal immediately going forward.
My relationship with my corporate team is like a family. See, nobody is perfect. I do mistakes. I learn from my mistakes, and that's a word what I have given to my corporate team. गलतियां हम सब करते हैं, कोई परफेक्ट नहीं है, बट गलती करके सुधार के आगे बढ़ने में जो हिम्मत चाहिए वो मैं हिम्मत में देता हूँ. I always decide I am your leader. I am the leader because I want to create another good leaders. So I give full freedom to them for taking decisions. They do mistake, come back to me, I correct it and send it back to them.
Dr. Sanjay is always an inspiration, as I said, and Dr. Sanjay brings in the energy that you really need in the organization. I've seen that when he walks into the conference room as well. It's a mixed kind of feeling, but people know that he has the energy. And he shows that very clearly. He's experienced in that. He knows how to handle the team. He knows how to handle the business right now. And people look forward to that energy. But that's on a good day. That's on a good day. If it's not a good day for you, if you've done something wrong, that energy can be dampening for you as well. That's the way I would say.
We have no cost difference. Treatment remains the same. Quality remains the same. You have money, you don't have money, we still treat you. We don't differentiate because you are a laborer, you will get a different quality of treatment. No. Also, some of the clinics, what we have, especially the dental clinics, a lot of wealthy people visit us because dental is never covered by any of the insurance. And the cost of dental treatment in UAE is very high. Now, what we treat the dental patient and the cost at which we treat the dental patient for the blue collar remains the same cost for a multimillionaire when he comes to my clinic. But the quality is not compromised. Money comes. I was never fascinated with the money. Today I have earned a lot of money, more than what I expected in my life. The smile on the face means millions to me. Today, post-COVID, a lot of people dying. I see when I did service to this country during COVID, I was above 60, I am diabetic. Everybody used to scare me, something will happen to you, something. You know what saved me? The blessings of my millions of patients. I never got COVID, I was never tested positive. I was never sick during the COVID. And I'm very happy that these blessings are working more in my favor than the bank balance which is there.
I'm Rosie Sanjay. Dr. Sanjay is my husband. He's very passionate about his work. He does everything for us, like for the kids, everything. Even we never had any problem with anything. He will solve all the problems. Nothing comes to us actually. Almost every day he makes the tea for us together. We have a good time, free time with me, and we always have a good discussion about things that time. So it is nice. And also he cooks. I have no problem any guests coming home. He's the one he takes the responsibility and he cooks and he does the best job actually. I feel really proud because he's done so much to the community and to the country. So I feel really proud to be being with him.
We finished 35 years of marriage. She has been a pillar of support in my life. Bringing up my both daughters, she has played a very crucial role.
So as a father, he's definitely strict. I think growing up, he was very particular about our academics and making sure we did well at school. And also, he's a naughty one, so he would also irritate us or annoy us or, be playful as well growing up. So he was a mix of both. And he is a big foodie, and so am I. So he would always be up for going and trying out new snacks or getting fun stuff. So we're always partners in crime when it comes to wanting to eat good food.
I have two daughters. Both are not into medical field. The elder one is an architect. She's settled right now in Los Angeles. The younger one was also into finance. She has done masters. She's CFA. She was also in USA. By great difficulty, we could convince her to come back to UAE. The good news is Divya has become a board member now. I'm trying to push her into the business. In my dictionary, there is no word of impossible. Everything is possible. Impossible, if you break into letters, it is I am possible. Where others are failing, I start it and I complete my journey. The philosophy of Right Health is very simple. We give quality health care at an affordable cost to the doorsteps of every individual, which is a fundamental right of every labor, blue-collar worker in this world. Jab tak hai jaan, keep helping others. Keep helping others.